stem cells have basically two characteristics. Once they have the ability to self-renew, that means every cell will give rise to other cells. Two, they have the ability to differentiate. That they basically can differentiate to wherever you put these stem cells. If you take these stem cells and put them adjacent to your nose bridge, they become cartilage. If you put them in your skin, they become skin. If you put them near your heart or lung tissue, they become and they basically emulate the microenvironment or where they are. I usually refer to them like a 2-year-old kid. If you put them in an environment, they will basically are influenced by where they are. So, and the next slide is the next slide is something that really interesting happened. These two gentlemen just received the Nobel Prize for medicine. So what we can do, rather than really using embryonic stem cell, we can take cells from any of you, from your skin, few cells, grow these cells, inject these cells with 3 or 4 genes, and revert you back to your embryonic state. And then from there, basically grow cornea for you, grow heart tissue, whatever you like that matches you. You don't have to use the bone marrow cell transplantation, then be on a lifetime anti-rejection medication with that side effect. So this is really a very promising science. Actually, the technology that in the new product, the StemCellCharacteristics product, is based on this technology. And we're proud to say that we have a patent that is pending in US courts supporting this technology, specifically in the cosmetic area. It looks like we are going backwards. So we do a lot of stem cell therapy. I'm going to not spend too much time here. You can basically take your own stem cells, isolate this, and treat you with COPD or cardiovascular disorders. We also use this in aesthetic and cosmetic and orthopedics. And I can talk to you separately if anyone is interested to go over this. One more. Again, I won't confuse you with this process. So the fat is isolated. You see the red button. That's the stem cells. The stem cells is isolated. And these are some of the before and after pictures that you can basically see. This is another lady. And yet this one. And besides face, we also use this. We use this technology also in a breast and butt augmentation, among others. This is our skin graft. We actually make this artificial skin. To my left, you have a normal skin. To the right, you see basically an artificial skin, 3D skin that we build in our laboratory. This is, you see some imperfections in the cornified envelope and in the red ridges, but for all intents and purposes, this artificial skin behaves similarly to a normal human skin. I'll show you a couple of pictures. This is actually a laboratory that we built in Guadalajara, Mexico. And I spent about 6 months getting this product out of the ground or the company. This is how we deliver our graft. We are in Children's Hospital in Guadalajara. This is a civil hospital, which is compared to our stuff here, it'll be a county hospital. This is a 5-year-old burn patient, and this is before and after, diagonally, if you can see this. The next slide, this is a 2-year-old burn patient. Again, 3 weeks later, you basically see the dramatic improvement from This is a diabetic leg ulcer, again, in Mexico City, in a huge dermatological lab, and we could basically save this patient from a diabetic leg ulcer. I'm going to move in further. This is one of my favorite slides. It will take me about 15 minutes to explain this, but the growth factors and cytokines from the product that Steve and Michael have put together basically will behave in that. If you really look on the top, you have a TGF-beta receptor. We have TGF-beta, VEGF, among other growth factors and cytokines and interleukins in our product. So when you apply this skin graft to your face or to your hair, they basically stimulate your own cells. They send about 110 different cascade of events. The message goes to the nucleus, the DNA, to the chromosomes. The chromosomes basically send the signal to the ribosome. The ribosome will package the protein, in this case collagen, and sends the collagen up to the cell membrane, and hence reduces the fine line and wrinkles. So you have more volumation. As we age, we lose volumation. We lose volumation not only in our skin, but in our entire body. So this is basically revolumizing your own tissue by stimulating your cells who have gone dormant, basically wakes up your own cells and brings back some of the volumation and luminosity in your skin.